And now this. Colorado health officials reporting that about the sudden death of a healthy 16-year-old boy. It was caused by a rare strain of the plague, as in Black Death. They believe he contacted it from fleas on a dead animal that he came in contact with at his family's ranch. Look who's here, Dr. Marc Siegel. Is this bubonic plague, the Black Death stuff?
Well, most likely, yes. and we saw 50 million deaths from that back in the 14th century. And this is a big deal. But I don't want people out there to think that this is now a resurgence. In fact, there's been 3 cases of plague in that same county in Colorado over the past 30 years, which implies that the rodents there have it, maybe rarely have it. And then fleas get on the back of a rat, they pick it up that way, and then they spread it to a human. Now, in this case, this tragic case of this 16-year-old boy, who was apparently a great baseball player and a wonderful athlete, he didn't have what we call the boo-boos, the lymph node swellings, which are telltale signs of the plague. He didn't have that, but he was coughing up blood, and he had other signs of the plague, and he started with flu-like symptoms. And it's a lesson there for doctors everywhere to think outside the box, Stuart. This is not flu season, so somebody comes to me with flu-like symptoms. I don't think plague, but I may say this is not the flu.
Is there such a thing as a vaccine against the plague?
No, but there's no vaccine, but there's treatment with antibiotics that will cure it within the first 24 hours. If you don't get to it quickly, it's a 30 to 60% death rate. It's a killer.
Well, you got to spot it then.
Spot it and treat it right away. And you can look at it under a microscope, so you can identify it. So if you're thinking plague, you know, in this county, maybe you would be thinking plague. You can do it. But it's very hard to diagnose.
But it's just such a jolting headline. The plague in the year 2015 in the United States of America. That's a shock when you see that kind of thing.
Well, and because people think, oh, it's gone, but it's not totally gone. And it can rear back up in the West. It's never going to be like it was, but we have to be on the lookout for it.
Yes, we do. Doctor, thank you very much indeed.
Good to see you.
Thank you.